P3 Isolator Setup Instructions. Prepare the P3 Isolator by inserting the 5 silicone portholes into the dome. To insert silicone portholes, begin at the bottom of each circle opening on the dome, working your way around the opening. For easiest insertion, place one hand inside the dome and one hand outside the dome to properly insert the portholes. Twist the oxygen and suction attachment ports into place on either side of the dome until tight. Attach the disposable drape to the dome by placing the middle hole over the dome's top securement peg first. Proceed to secure the drape over each additional securement peg on both sides, working toward the bottom. Place the dome and drape over the patient and secure to the bed utilizing the Velcro straps for added stabilization. Attach the oxygen and suction tubing to the appropriate attachment ports. Turn on the suction to desired flow, recommended high flow suction. Turn on the oxygen to desired flow, recommended 8 liters. Once the suction and oxygen are turned on and the prior steps above are properly completed, the P3 isolator will create a negative pressure environment. At this point, the provider can proceed to perform the desired tasks or procedures within the dome utilizing the silicone portholes. The P3 isolator can help reduce the risk of caring for patients who require contact or airborne isolation precautions. Appropriate PPE is still required for the healthcare providers. It is recommended that supplemental oxygen be supplied to the patient while the dome is in place over the patient. Pulse oximetry monitoring should be utilized at all times while using the P3 isolator. Set up the P3 isolator per manufacturer's instructions and place over the patient. Place anesthesia circuit with mask or ambu bag with the mask within the P3 isolator dome through the silicone porthole. It is recommended that a video laryngoscope such as a glide scope be used for intubation. Place video laryngoscope and endotracheal tube through silicone porthole. Providers should utilize the rear 2 portholes as the working ports for hands and arms during intubation. Proceed with intubation. Leave P3 isolator in place to provide a negative pressure environment. It is recommended that all items used for intubation be left inside the P3 isolator for 5 to 10 minutes to allow for maximum air exchange within the dome to reduce contamination of the external environment. The ports can be identified by the labels oxygen or suction. They can be placed on either side of the P3 isolator dome. This is unique to the P3i. Depending on what the user needs, the oxygen and suction ports are interchangeable. Align the port's backside with the cutout on the P3 isolator dome and twist into a secured position. Attach suction tubing to the suction port. Attach the oxygen tubing to the oxygen port. Turn on suction prior to turning on oxygen flow to create a negative pressure environment. The viral filter. If using the P3i outside of the operating room, be sure your system has a viral filter in place. If not, please use the viral filter that comes with the disposable P3i packet. The silicone portholes should be placed prior to attaching the disposable drape. Begin by aligning the groove of the silicone porthole with the bottom edge of the P3 isolator's circular cutout in the dome. Moving upwards around the circular cutout, continue to align the groove until it is secured in place. Repeat this process until all silicone portholes are in place. Some providers have found that having one hand working from the interior and one hand working from the exterior of the dome can facilitate ease of placement. After the silicone portholes and oxygen and suction ports are in place, the disposable drape can be attached to the P3 isolator. Attach the disposable drape to the dome by placing the middle hole over the dome's top securement peg first. Proceed to secure the drape over each securement peg on both sides, working toward the bottom. At this point, the dome and drape can be placed over the patient and secured to the bed utilizing the Velcro straps for added stabilization.